Namaste, I'm Nuthan Manohar, adjunct faculty at the IIM Kozhikode and guest lecturer with JIPMER and various other institutions, and the founder of Metromed. And on behalf of Times of India, I welcome each one of you to the TOI World Heart Day Symposium 2023, where every beat counts. The future of heart care is poised for remarkable advancements driven by emerging technologies. Innovations in telemedicine are enabling remote monitoring of cardiac patients, while artificial intelligence and machine learning are revolutionizing diagnostics. Wearable devices and implantable sensors, on the other hand, are becoming increasingly sophisticated, providing real-time data on heart health. Overall, the fusion of these technologies promises a future where heart care is not only more effective, but also more personalized, accessible, and preventative. This session of Times of India World Heart Day Symposium 2023 will explore the future of cardiac care in terms of technological advancements. We have a distinguished panel of experts with us, each a stalwart in the field of cardiology. Please allow me to introduce each one to you. So we have with us Dr. Arun Gopi, Metromed Hospital, Calicut. Dr. Arun Gopi is one of the active leaders at Electrophysiology Department of MICC. We also have with us Dr. Jagdish S. Hiremath, Ruby Hall Clinic, Pune. We also have with us Dr. Balbir Singh, Chairman and Head of Pan-Max Cardiology, Max Super Speciality Hospital. Now diving right into emerging technologies, Dr. Arun, you've been at the forefront of adopting emerging technologies in electrophysiology. What are the emerging technologies that are expected to shape the future of heart care according to you?
Yeah, at the outset, I thank Times of India for this initiative, and as like any branch of medicine, cardiology also has witnessed, and we have actually endorsed a lot of advances in this technology, which have actually made a real paradigm shift in the way we manage our patients. There are many subspecialties in cardiology. Each of these branches have been leaping forward at massive pace. For example, the most common procedure that we do is coronary angioplasty, which the way we have been doing this procedure has changed. We have moved towards more of precision angioplasty, using what we call as intravascular imaging. Earlier, the whole procedure used to be done with a fluoro or X-ray guidance. Now we are putting specialized catheters inside the heart, which gives us a clear picture of what is happening inside the vessel, understanding what is the disease process and how to treat it. With all this insight, doing an angioplasty in the most perfect way possible, what we call as precision angioplasty using intravascular imaging. For many years, a lot of the complex blocks, we required open heart surgery. Now with newer emerging technologies like intravascular lithotripsy, which is actually a debulking strategy. A lot of these blocks used to be referred for bypass surgery because of the extensive calcification that they had. But now with orbital atherectomy, intravascular lithotripsy, and laser technology, we have been able to debulk or remove the calcium from most of these blocks and have been able to implant stents in them. Every branch, as I said, has been expanding. If you look at the therapy for rhythm disorders, from the conventional pacemaker, which most of the people would be familiar to, now we have the world's smallest pacemaker, or the leadless pacemaker, where the whole pacemaker circuitry has been minimized to a size of a vitamin capsule. So it just requires a single day procedure of one puncture through which we can implant the pacemaker, no scar, no bump on the anterior chest wall, and the patient goes home the next day without any need for any wound healing. And most of these devices can also be monitored via satellite, via remote monitoring, which also avoids the needs for a personal contact. For treatment of the fast arrhythmias or the fast heartbeat problems, we have very complex technologies like 3D mapping, cryoablation. These are all actually, although these the names look fascinating, but they are all done by minimally invasive procedure, just requiring 1 or 2 sticks in the groin, requiring just 1 or 2 days in hospital, and we are able to deal most of the complex rhythm problems with these technologies. One of the arenas which only surgeon had access was valvular heart disease, which required, for a person had a valvular lesion, he had to have the chest cut open and the valve to get replaced. Now we have technologies, what we call as TAVR, which are percutaneous technologies which allow us to treat valvular heart disease without the need for opening the chest. Again, minimally invasive procedures done under just conscious sedation, which allows every person, even at extremes of age, also to undergo these procedures with least amount of complications and getting back to active life as early as possible, in fact, with good quality of life. These are just a bird's eye view of what is being happening. A lot of these have been happening, and we should be happy to say that what all have been coming in the West, we are able to adopt these technologies as early as possible and deliver them to our patients.
Thank you, Dr. Arun. The main point being that, quality of life, especially post-operative, has greatly improved with the emerging technologies. At this point, Dr. Jagdish, could you help us understand a bit more about implantable sensors and how do they play a role in heart care? And what about wearable devices? One goes in and the other goes out. So if you could help us with implantable sensors.
Major monitoring that took place in the past was of the rhythm or the ECG. The commonest symptom is the patient faints at home. Nobody has seen him. He comes to us maybe 2 hours later or 3 days later. And then it's impossible to find out what's happened to him in that particular period, whether the heart slowed down or it became fast or it was a drop of blood pressure. So we need home monitoring for such a patients who have, into quotes, the syncope is the symptom that we discuss, sudden brief loss of consciousness and coming back to life. Once it is decided that this is because of the heart and not related to neurology problem, we implant sensors in these patients. These actually are put inside the skin, and they can stay there for as many as 1 year or 2 years. They call loop recorders, by which they keep recording the ECGs and keep giving us signals. All the monitoring takes place in the artificial intelligence, in the iCloud. And if there are any signals related to that abnormal, they are related to the doctor or the person who is monitoring that. So there are chances that somebody who's had a brief syncope 2 days ago, 2 months ago, there is a good chance that after so much monitoring, we will pick up what the abnormality was. Initially, these monitorings were of 24 hours. You put outside the body and you move around with cumbersome wires moving. And then 24-hour data was too inadequate to make any conclusion. But this wider data procuring, we are able to make precise diagnosis related to that. Wearable devices, yes, there are wearable devices wherein previously there used to be implantable shock machine that would be implanted in the body. But now wearable ones have made things a lot of easier. They are yet not accessible to the common man, but it's happening. As we are discussing the future, it's going to be around in India as well.
Thank you, Doctor. Just for our understanding, when you mentioned these wearables, these are specific cardiac wearables. What about the other wearables that say that they can check your ECG, etc., like a Fitbit or an Apple Watch, etc.?
We are actually looking at a vest that all of us will wear in the future, and that will have all kinds of sensors, whether it is sodium, potassium, oxygen, and this kind of a vest is envisioned by a Indian in US, and it's being investigated right now. So it will become a reality wherein all of us wear it to office and day to day, and all the monitoring will take place again in the iCloud. And if there's any abnormality related to whether it is sodium, oxygen, or potassium, all this would get to us through some alarm system. So we are heading for something which is completely monitorized human being. I really personally don't like it so much, but that's how life is, and that's how the technology will proceed. Especially in the medical legal era, we need to diagnose things correctly and deliver things. I personally feel we should be more human, and a doctor-personal relationship with the human being should be better. But as it is, as I said, life is like that, and we are heading towards these wearable sensors also.
Thank you, Dr. Jagdish. At this point, Dr. Balbir, could you help us understand about innovative surgical techniques that are on the horizon for treating heart conditions?
So it's a great era for an interventional cardiologist to be in, and it's a great era for patients to be in. In my lifetime, I've seen changes happen so rapidly And we have to keep up with these changes. We have to learn, learn from our mistakes, and come to a point where we are perfection. So perfection is the word at this time. And we've seen procedures which were very complex surgical procedures to become very simple, where the patient can be done with the procedure and go home next day. Who had imagined a decade back that a person who has a valve disease will have a valve procedure and be discharged next morning because the procedure was done under local anesthesia. He has no cut on his body and he doesn't even know that a valve has been changed. This is a real great innovation. Who had realized that a person who has a complex arrhythmia and was likely to die gets a procedure and a device and goes home next morning and has a better lifespan. So the whole medicine and technology is actually revolving around to give patient a better outcome, make physician's life happier. There was a time in my clinical practice when an 80-year-old used to come and family used to say, I would say 2 decades back, maybe a decade back, 85 years, and family would say that he has lived enough. And now if a 95-year-old comes to me with a heart problem and he dies, I feel very bad about it. And I can tell you this never happened earlier. So that means we are struggling and giving a better life. I operated on a 102 years old last month and he's doing very well. So this speaks for technology advancements, and it's a great time to be in this field of interventional cardiology because it's evolving so rapidly, and it's good for human beings that we are at this juncture where we can give a better life to them.
Thank you so much, Doctor. You mentioning that age is really becoming just a number when it comes to cardiac care, thanks to all the minimally invasive procedures and emerging technologies there. So thank you so much, Doctor. And now the question is to Dr. Arun Gopi. Dr. Arun, what about telemedicine and how does it help in advancement of heart care? And in a country where there is a lot of rural areas, how does telemedicine play a role here?
Yeah, this is again one of the emerging technology which has actually made patient follow-up more easier. Actually, we got a glimpse of this during the COVID pandemic when personal follow-ups could not be possible. Now we have technologies which allow us to remotely monitor our patients after implantable devices. It's called remote monitoring, where if we have implanted a pacemaker, earlier if there was the patient suspects that something has gone wrong with the device, he needed to come in person to the clinic, get the device checked and meet the doctor and understand what is going on. Now we have devices which the patient can take with them anywhere, in any part of the world, any part of the globe they go. If there's an issue, the device can be remotely checked, as we would say global tracking, where every device is linked to the satellite and the physician gets an information of what is going on his email. So instead of having personal follow-ups, the patient, especially elderly patients who find it difficult to come to the hospital. During times of pandemic, we had COVID, Nipah and so on, where we would really want less patients visiting the hospital. For people who are in a different part of the world where they get shocked from the device and not knowing what is happening, just remote monitoring would give us an information where we can actually reassure them on a phone call what is going on and what needs to be done. So telemedicine has come a long way in following up our patients, giving them information online, and thereby bridging the gaps that had appeared during the COVID pandemic.
Thank you, Doctor. If I may pose one more question. When it comes to gene editing, yes, telemedicine is external and gene editing is so personal. When it comes to gene editing, how does that impact in the prevention and treatment of heart diseases?
It's almost a technology which is still, I would say, in the infancy stage, where we are understanding more and more of the genetic aspect of disease. We are understanding the pathophysiologic substrate, the genetic substrate behind the disease, but our still ability to edit the genomic structure of an individual and modify the disease is still in a limited stage. We have gene therapy for some diseases which are a game changer, but it's only available for some limited orphan diseases, which are in fact rare diseases.
Thank you so much, Doctor. Dr. Jagdish, we were just discussing about telemedicine and how it can serve the underserved areas in India and about gene editing. Could you help us understand what are the key challenges in implementing emerging technologies in heart care?
Implementation, the biggest stumbling block is the cost. So the stumbling block, as I said, was the cost. In all these technologies, which are wonderful, we are looking at a very vibrant future for treating cardiology patients. They would get better results and better outcomes and better longevity. But the Achilles heel here is the cost, because it doesn't reach many people, and it will happen like over a period of time with the government efforts and other efforts. It does become cheap and it does reach to the common man later on. But at present, it is the cost. Then we did a lot of teleconsultations during the corona period, and now we are trying to reach the rural areas. There the net connections and all simple technical things are yet a problem, though there is a remarkable advance. Like, I'm surprised remotest possible village can connect to me through internet, and we can have a telemedicine consultation with them. It is possible now, but it is yet to get, shall we say, refined a bit more. And that is also a challenge with the connectivity. But we are getting there, I think.
Thank you, Doctor. Dr. Balbir, we just heard from Dr. Jagdish earlier about how it could become a future where you have access, an incredible future where you have access to all the real-time monitoring data, and at the same time it seems very, very impersonal. So if you could help us understand, what role does patient-generated data and mobile apps play in managing heart health?
Right. So this is a big topic and is of great interest to me, because I was instrumental in developing a heart failure app, which is now which is being given to my patients. It's a wonderful idea because it attaches you to the patient. The patient is continuously attached to that. The most important thing that happens with this app is, like, for example, we ask him to do a daily weight tracking. We ask him to do a daily how much intake of water did he take. We ask him to do a monthly blood tests, which are put on the app. So he's involved in his own self. He's involved in his own treatment, which is the greatest thing that can happen. By the click, I can find out which of my patients is doing well and which patient is not doing well. The challenge is not developing the app. The challenge is not putting all this together. Challenge is also patient education. And third challenge is that how do we analyze this data? So we need more manpower. We'll have to have AI tools to help us in these apps, because the AI has to tell us that out of this 1,000 patients, these 5 need attention, because you can't give attention to all the 1,000 data that you got. You will need a very big team to do that. So we will need AI tools to actually screen those 5 patients of those 1,000 who are not doing well and need your attention immediately. So these apps are very useful. The second app that we worked on, I was the 5th in the globe to use that, was in a device which had a remote monitoring with the patient. And I did this on February of 2020, just before the COVID was launched. And this was the first device in India. And immediately after that, the patient went home the next morning, and the COVID was announced. There was a lockdown. And fortunately for this patient, he was already on connectivity with us. And we knew he had a problem 3 months down the line during the acute lockdown. We sent an ambulance to his home, got him to the hospital with the lockdown on, and his life was saved. So you can imagine how this connectivity is going to be so important. This field is going to explode. There is no end to it. If internet has exploded to an event that anybody who's sitting idle anywhere, airport, railway station, he's on with his phone. So if the internet has exploded so much in our daily life, it has to explode in the healthcare system, but the data that will come out will be so huge that unless we have AI tools to handle it, human beings will not be able to handle this data.
Thank you, Dr. Balbir. I think we'll add on to that. Dr. Arun, if you could give us some more insights on how artificial intelligence is used for diagnosis, as well as what about machine learnings when it comes to cardiovascular diseases. So if you could help us, give us some more understanding of these 2 topics which we just touched upon.
Yeah, as Dr. Balbir said, AI has been on the forefront of revolutionizing medicine, and cardiology has been really in the forefront of this. There are many AI-based tools actually which help us in risk predicting, predicting whether the patient can have adverse cardiovascular outcomes based on what risk factors he has. AI has gone a long way in improving our diagnostic softwares based on the inputs that these devices get. The diagnosis, the ECG-based diagnosis, the echo-based diagnosis. So they have actually fine-tuned all these things, and we have so much AI-based solutions for improving our diagnosis, and it will definitely go a long way forward in delivering better therapy. The diagnostic inaccuracies are going to be taken off, and we are going to at one go have and more accurate diagnosis, which will definitely go a long way in improving the treatment.
Thank you, Doctor. Thank you so much. We had even touched upon about how expensive these technologies would be for the average Indian. So when do you foresee all this technology being made available to the wider mass?
To be frank, with every new technology, there's a lot of research that goes into it. There's a lot of studies that goes into it. So as we have seen, every new technology comes with a bitter cost to begin off with. As Hiremath sir said, Achilles heel is the cost. But as we do more and more of these stuff, and the number of devices become more, the cost actually comes down on follow-up. So with the more and more penetration of these emerging technologies, the cost of devices have really come down. And to be frank, even most of our government insurance is also allowing these technologies to be used in patients, making it more and more affordable. And we expect that the healthcare policies would cater to a time when each and every emerging technology will become accessible to every Indian in future.
Thank you, Dr. Arun. Hopefully it is accessible to every Indian in future. With that, Dr. Jagdish, I'd love to know more about personalized medicines. And when it comes to heart care in the future, what is your take on personalized medicine? Will personalized medicine make it impersonal?
Of course, now with the modern medicine thinking and the genetic studies and all, we know that every individual comes with a different genetic setup and different background. So how to reach that, form that medicine for him, how to formulate these medicines individually, and how to deliver it to the genes required is what is being thought of. Not so much in cardiology as of now related to the personal medication, but that is where related to, say, the cholesterol medicines, maybe a blood pressure medicine in the future. All these are patient genetic setup will be studied. Amongst the 4 or 5 choices, the best possible one for that particular individual will be taken up, and hopefully it will give better results, less side effects, and less frequency of medicine. All these things should be possible in the future. Whether it will become impersonal, I feel it is getting already very, very impersonal. The doctor-patient bond is getting disturbed to a great extent because there is no personal meet. There are patients who would request me to have a one-to-one meeting rather than the online consultation, because even that much, even if I'm talking to them, they feel that personal touch is important. Of course, we have to draw a line. Whatever is best for the patient will be delivered. But the personalized medicine, as you said, is on the way. It will come.
Thank you, Doctor. You spoke about personalized medical formulations, or maybe at least choices from the various formulations that are available. If I could ask you, how do you think the healthcare systems itself, is adapting to evolve to these changes in healthcare technology? On one side, you have a lot of data coming in. On the other side, you have personalized medications coming in. You have lesser time spent post-operative care, etc. So how are healthcare systems preparing to adapt to these evolving changes?
Well, I guess they are doing well in adapting these systems, because India is not behind any of these Western countries in adaptation. The cost has been an issue with the improving technology. It comes with a price. I guess the GDP of the country and the economic health of the country is also getting better. We have to keep that in mind. The government is making many agencies which will help the patient. So this is also going to help. But the healthcare system has to get prepared, because this is going to be a different society than what it was in the past. In the past, we did not have so many technological gadgets with us. We did not have so much information, how to gather this and how to act on it. This we'll have to have these challenges. We have to find solutions to this. For example, this app that we developed, we have a team which works on it. So the team has a cost, because everybody has to be paid a salary for that. But the team is in place to give patients the benefit. So patients would buy these apps and would spend some money on it, but they have to be given that care for that. So if you can give a care using these apps or using these new gadgets or new devices, I don't see any reason that it won't come in. It has to come in. Everybody wants a better care. After all, the COVID taught us few lessons. And one of the lessons which is very important is that your life is only once and you have to take care of it. And which is very clear now, that people want a good system to take care of them. They think that everything else is secondary. Health is the major issue. So health is going to see a lot of focus on, and is going to be a very important thing to have.
Thank you, Doctor. A follow-up question, as you mentioned, with COVID, we've started valuing our lives a lot more. Likewise, there has been a lot of cross-functional, interdepartmental as well as cross-functional cooperation that has happened and collaborations that have happened. In future for cardiac health, what kind of collaborations do you see? Is it with physicists or is it with photoimaging? What kind of collaborations do you see when it comes to technology?
Right. So one of the major collaboration which always happens is a scientist and a physician collaboration. The scientist wants to know, what are my challenges? Where am I facing the problems? The industry wants to know how they can develop. Industry has a huge incentive in it. Let me tell you, everything in this world is intensified. Everybody wants an incentive. The industry, scientist, everybody has an incentive to do better. So if they are to do better, they want to know my challenges. So this interaction, and I want a better tool to treat my patients. Ultimately, the patient is the most important thing in my life. So if a scientist can provide me those solutions, they are going to help me. So scientist, which could be IT, or it could be a scientist at the level of IIT or whatever. AI is going to come in a big way. For example, AI tools could help diagnosis in imaging, could help diagnosis in finding a solution to my problems in a patient and give a better answer than my mind can work. Ultimately, it will be the human mind which will override whatever the AI says, but it will contribute in a very big way. We can't shy away from saying that our minds are much sharper than any other mind. We have to use these tools to get a patient outcome which is always better and the most important priority we have. So a combination of a scientist, industry and doctor as a partner is going to be the key forever. It is not that a doctor alone can do it. It is not alone a scientist who can do it or industry who can do it. It has to be a combination. So we shouldn't say that this is a caucus they have produced. Why can't a doctor do this? It has to be a combination.
Absolutely. Thank you so much. Looking forward to that deadly combination, which is going to save a lot of lives. So thank you so much, Doctor. Dr. Jagdish, if I may request you, because you seem to try bring in both aspects of it, the emerging technology as well as the personal care. What is it that, if you have to leave us with some advice, some summary for emerging technologies, what would that be?
For emerging technology, I think as a patient, as a society, there needs to be a lot of awareness. It should not happen that the person beyond that other side of the chair knows everything and the person doesn't know. So awareness in the patient population has to spread a lot. They should be aware that these kind of treatments are available, and the capabilities of the team treating you should also be probably available to them. And when you have this kind of a combination, and the one point I wanted to say was the cross pathies also, whether it is Ayurveda, homeopathy, if they have some excellent treatment options or otherwise, they also could be incorporated through these newer technologies. So apart from this, I would say that the society has to get aware, the doctors have to adapt themselves to newer technologies. Gone are the days when we would sit with our books and read overnight and do things. Now they are available at the touch of a button. So the entire doctor team needs to be training themselves to get aware of the newer technologies.
Thank you, Dr. Jagdish. So as we come to a conclusion of this exciting session on heart care, future directions and emerging technologies, I would love to express our heartfelt gratitude to our esteemed panelists. Dr. Arun, Gopi, thank you so much for your time. Dr. Jagdish S. Hiremath, thank you so much for your insights. You bring in a lot of humanness back to this heart condition. So thank you so much, Doctor. We also have with us Dr. Balbir Singh. Thank you so much, sir. It's been an honor having you with us. Thank you for sharing your profound insights into future of heart care and emerging technologies in the field of cardiology. On behalf of Times of India, TOI World Heart Day Symposium 2023, where every beat counts, we thank you. Until next time, stay heart healthy and keep those heartbeats strong. Thank you so much.